Hi, Joan. My name is Dr. Richardson. I'm one of the obstetricians here at the practice. I understand you're pregnant. Congratulations. And it says here you're approximately 8 weeks along.
Yes, 8 weeks. And a long way to go.
And this is your first baby?
Yes, it is. I'm excited, but kind of scared.
Of course. And let me assure you that everyone here at the clinic will be happy to help you in whatever way we can. Now, before we begin the exam, I would like to ask you a few questions. Our clinic is quite concerned about the effect that smoking can have on pregnancy. So I would like you to take a look at this checklist and tell me which statement applies to your current smoking status. A, I have never smoked, or I've smoked less than 100 cigarettes in my life. B, I stopped smoking before I became pregnant and am not smoking now. C, I stopped smoking after I became pregnant and am not smoking now. D, I smoke some now, but have cut back since I found out I was pregnant. Or E, I smoke regularly now, the same as I have been.
It's D. I'm still smoking, but I've cut down. I was at about a pack a day, and now I'm down to around 12 or 14 a day.
Joan, I want to strongly advise you that quitting immediately is probably the single most important thing that you could do for the health of you and your baby now and in the future.
Yeah, I was guessing you were going to tell me that. But I have to tell you this. My mom and grandmother smoked the whole time they were pregnant, and nothing happened to their babies.
Okay, the only thing I can say about that is that they beat the odds. And Joan, we didn't know then what we know now. That's why now all pregnant women are strongly advised to quit.
Well, yeah, you might be right about that. I was reading about all the things that can happen to the baby from smoking in one of your brochures out in your waiting room.
Yes, there are more than 4,000 chemicals and toxins in cigarette smoke, including ammonia, acetone, and lead. And these chemicals pass through the placental barrier to reach your baby.
Really?
Exposing your baby to these chemicals in the uterus, well, it's not a good thing. Babies of women who smoke have lower birth weight, are at a much higher risk of being born with a cleft palate, and are more likely to have other problems. There's a greater risk of going into labor early and of losing the baby during the delivery.
I didn't know that.
Then there is the carbon monoxide. That's the same gas that comes out of your car's tailpipe. It reduces the amount of oxygen that you and the fetus get, and that can slow down the growth of the baby.
Wow. You never hear the specifics. I mean, I know it was bad, but I didn't realize.
I'm not trying to scare you. I just want to give you the facts so that you can make an informed decision about what you want to do. And as you said, most expectant mothers, they don't know all this.
Let's say I do want to quit. Can I use the patch? I heard it's very helpful.
Well, as a rule, we try to give pregnant women as little medication as possible, and then only when it's absolutely necessary, no matter what kind of medication it is. However, when you smoke, you expose the baby to thousands of chemicals. If you use a nicotine replacement therapy, you only expose the baby to one chemical, nicotine, and that's at a much lower dose and for a much shorter amount of time. The FDA has asked us to be cautious when using these products with pregnant women, but we can use them if needed. And we may decide at some point that we want to use one of these medications, but I would like to look at another option first.
Okay. So what do we do?
Well, to be as conservative as possible, I would like you to try and cut down without using any cessation medications. Since you're smoking about 14 cigarettes a day, let's set a quit day for 2 weeks from now. So on that day, you will stop smoking completely. However, between now and then, I would like you to cut out 1 cigarette each day. That way you shouldn't go through any drastic withdrawal.
I think I can do that, but I'll need some help.
I was just going to mention that. We do have a quitting group here at the clinic, and the group leader has been specially trained in smoking cessation counseling, and she'll help you. She'll help you identify situations that trigger you to smoke and teach you to deal with them without a cigarette. And the other group members will give you lots of support.
That sounds good. But what if I can't cut down all the way on my own?
Okay, in that case, I'm going to suggest that you try the lozenge, but only when you really need it. I don't want you to use the patch because that's going to give you a steady amount of nicotine all day long. But if you use the lozenge, then you can dose yourself whenever you're having an urge. But I only want you to use it for 2 or 3 weeks until the majority of the urges have passed. But if you can do this without the lozenge, that would be even better.
Thanks for your concern. I appreciate your being so frank about all this. I think knowing this, I'm willing to go through a little discomfort to quit. Besides, just thinking about it now, I can already think of 3 or 4 cigarettes that I smoke every day just out of habit and not because I really want them. I can eliminate those right away.
Good. Okay, so let's see what your smoking level is and how you're feeling next week when you come back in. And we can decide then whether you're going to use the lozenge or not. Now I'll give you a few minutes to change, and then I'll come back and we'll start the exam.